Hello, everyone. Home care is an important issue in Canada as we navigate shifting demographics, an evolving healthcare system, and changing patient needs and expectations. In mid-January, I had the opportunity to represent the college in a roundtable discussion about home care hosted by the Federal Minister of Health, Dr. Jane Philpott, in Toronto. A reason for this is that the college has been involved with the Canadian Nurses Association and the Canadian Home Care Association in an initiative called Better Home Care. A link is provided with this video blog for you to access the first report. By the end of the meeting, a number of themes emerged through the participation of 20 key stakeholders present. The need for standards and the identification of best practices for the provision of home care. The importance of first targeting key vulnerable populations and areas of care, such as palliative care, the frail elderly, and patients with dementia. The need to have interoperable electronic medical records to enhance the seamlessness of care and to allow us to measure the impact of our efforts. And finally, the importance of recognizing and better supporting caregivers and others who form the circle of support for a given patient. There's no doubt in my mind that we need to be active, present, and proactive in this area of care. I am on record in indicating that family doctors should be able to practice in at least two environments, those being the office and the patient's home. Yet, there are parts of me that feel conflicted about our role in home care. When I was in practice in Corner Brook, Newfoundland, doing house calls was an integral part of the care I provided. It was a given for all of us in family practice in that town of 20,000 people. When I started working in Toronto, doing house calls seemed more complicated. The issues we faced included time management, such as dealing with traffic and parking, as well as safety after hours, to name just a few issues. Another reality is that infrastructure and remuneration models generally do not support care in the home as a given. So, at the same time as I support the initiative organizationally, I think we need to do more internally to better understand what is going on in the environment of family physicians on the ground. The objective here is not to shame and blame, but to seek an appropriate role in health system improvement. Although home care is included in our standards of training of residents and is an expectation for practice, I sense that how this is addressed may vary considerably across the country. I suggest that we need to understand this better and position this as part of the satisfaction that comes from the ongoing relationships we have with patients in caring for them in settings beyond the office, and that this is true for residents as well as for family physicians in practice. Finally, there is an evolving quality improvement and research agenda regarding home care just waiting to be seized upon. One of our spheres of influence in Better Home Care project is to advocate for and articulate how we can better integrate home care into primary care and family practice. I look forward to working with you to redefine a relevant and appropriate role for family physicians in home care, and of course I welcome your comments and feedback. Until next time, take good care.